Good morning. This morning I want to talk to you about chemicals. We are not chemical handlers, but in actual fact we do handle chemicals in our everyday work. Chemicals are a major part of our everyday life at home, also at work and at play. Some examples include things which are toxic, corrosive, solvents, and numerous other substances. As long as we take proper precautions, these substances can be handled safely. Chemicals that you use at home may include gasoline, paints, fertilizers, lawn chemicals, bug spray, paint strippers, kerosene, bleach, Drano, other household cleaners. However, chemicals you may use at work are more facility-specific solvents, laboratory chemicals, fuels, paint, various chemicals that we use, Bondo, and when we're doing handrail. You're going to encounter some various lubricants and other corrosives as you do your daily work. So we're exposed to chemicals in four ways. There's four routes of entry, and I want to go over that with you just for a moment. There is inhalation. That is when we breathe in dusts and mists and vapors. For an example, if you're working with pour rock, if you're working with Bondo, those are dusts that you might encounter. Also being around concrete that's being poured or concrete that's being mixed. Also, there's ingestion, that is eating contaminated food. For example, if you eat in the same area where you've been working, sometimes there's still airborne contaminants. Also, if you still have a lot of oil or material on your hands, when you touch your food and then put it in your mouth, you can easily ingest it. Also, absorption, that is skin contact with a chemical. For example, there are various things that we use that can cause dermatitis or eye irritation. You can use certain solvents that will eat right through rubber gloves, for example, xylene if you have any exposure or anything like that. So absorption is something that can happen on a job site as well. Also injection, that is if we force an agent into the body through a needle or a high pressure device. Hydraulic hoses bursting come out under an astronomically high amount of pressure. So these are all potential means whereby we can get agents into us, inhalation, ingestion, absorption, injection. You've all been exposed to this discussion during your orientation, but I want to reiterate it today. What can you do to protect yourself against chemical hazards? Well, you can read the container labels. That's one of the ways that you get information. The safety data sheets is another way. Safe work instructions before you handle a chemical. Also, using the specified personal protective equipment that applies to that particular chemical. Once again, you'll get this information through the SDS particularly. You may need particular kind of goggles or respirator, safety gloves, or even go so far as to have an apron or particular kinds of shoes or safety glasses with side shields. Be sure that if you're going to have to use a specific kind of PPE that's not normal to what you're used to, make sure you get training in it and are able to use it properly. Inspecting all your PPE to make sure that it fits properly before you use it. Also looking for defects in the equipment such as cracks or missing parts or rips. Ensure if you're using a respirator that it has the proper chemical cartridge for the particular chemical hazard with which you're dealing. Change the cartridges when necessary. So if you end up going down that road, realize that with regard to respirators, one type does not fit every circumstance. Know the location of where you can wash up, clean up, safety showers, eye stations, if they're anywhere available, especially on job sites. This is a difficulty. We have eye wash in our first aid kits and means of getting yourself cleaned up. Then also washing your hands before eating, especially if you've been handling chemicals, like if you've been applying Bondo, or even if you've been grinding and have a lot of dust on your hands where you've been working on a site. Wash your hands before you eat. Then leave your contaminated clothing somewhere where it's not going to be dragged into your house. If you can have a room or a place in your house where you can get yourself changed out of your work clothes and get them cleaned up before you hand them off to the wife or before you wash them yourself. That way you're not getting a secondary contamination. So something that you want to think about is that you're encountering these chemicals all the time. So I trust that you will consider this very carefully and learn from the information that we provide for you through the hazardous communication to handle the chemicals that you're going to handle safely and without injury or illness. Thank you for your time.